Clinical Monday, the best way to begin a healthy week. It's a happy Monday to you and yours, and welcome to it. We are live on Oral Pop's Facebook page, also on our YouTube channel. My name is Vee Ka Nkosi for this episode. And as you can see, today we are, for yet another episode, we are coming to you, courtesy of, I don't know which is the name. So when I read it, I say Dent-X. Said it right. For yet another episode, and today we are joined, or rather, the topic is oral health, and we are joined by our special guest, Dr. L. Magadla, who will be answering all the questions related to our topic. If you have any questions or comments, please make use of the comment section below and send them through. And we know in South Africa it is Oral Health Month, and it is observed for the entire month. So we are really trying to spread awareness when it comes to oral health. Hence, our guest is here. Doc, thank you so much for your time. Really appreciate it. And you have a beautiful space. Love it. Do the clients, when they get here, do they feel relaxed, even though they know that you'll be?
We've been getting some positive remarks. Yes, I think they are comfortable.
That's good. It's Oral Health Month. Let's start with saying, perhaps maybe, and I mean, I don't want to take it for granted that a lot of people might know what oral health is, but you know, if we are to answer that question, what is oral health?
So basically, oral health is the overall health of the mouth that includes the teeth and its supporting structures, which is like the alveolar bone, the ligaments that surround the teeth, the gums, also the surrounding parts of the mouth, the oral mucosa as well. Also, oral health also means being free from pain, being free from infection, as well being free from tooth decay. We say yes. So and also being free from impaired function of using your mouth. Mastication.
I got you. And then why is it important then, or well, I guess I wanted to segregate and speak about in young people versus in older people, but in general, why would oral health be important?
Because first of all, we need our teeth to eat, right?
Yeah.
We use our mouth every day.
Yeah.
We use our mouth to speak. You see, so good oral health, it allows you to get back to your social life, and allows you to speak confidently. Of course, allows you to eat and digest your food, to sustain your body.
Yeah.
But also, more than anything, good oral health also prevents oral infections that can spread to other parts of the body.
Is that possible?
It's very much possible. Very much.
Okay, I'm interested now how. So, does it, okay, because I'm trying to have a picture in my mouth of how would it then move from oral to the rest of your body?
Yes. Oral infections have been linked to a number of other general diseases. For example, cardiovascular diseases. There's a condition we call it infective endocarditis, which means the muscles of the heart are inflamed or swollen. So the infection in the mouth has a way of traveling to the heart, especially in immunocompromised individuals or people who had heart surgery, even knee surgery as well. Oral infections have been linked to cardiovascular diseases, to diabetes, to even Alzheimer's as well. Yes.
Wow. I know even heavy behind the camera there is, we did not know this, so I'm glad you are here to speak about that. But so a lot of people will then take oral health, I almost want to say for granted, because they really don't think about, that it could have, such impact on the body. Let's speak about how often should one get it checked out. How often should one come to a dentist to either do an overall, say, check, or Because we always leave it at the last minute.
Yeah.
When I have a tooth decay
Yes,
or when I
of
have a
course.
toothache, then that's when I come. But how often should one do?
We always advise that everyone should visit the dentist at least twice a year for general checkups and for tooth cleaning, right? Other people may be required to see the dentist more often than others, depending on their health needs, of course. Yes.
Okay. Can poor oral health affect my overall health? And when you spoke about, some infections in the
Yes.
can it?
Yeah. Yes.
To what impact, or to what I won't say detriment, but to that stage where it's now severe, or can it even get to a point where it's severe?
Yes. It can. For example, I mean, like I mentioned before, infective endocarditis, right? It's a very serious issue because imagine one of the most important muscles in our bodies is the heart muscle. So if your heart muscle is inflamed, that means that the heart function is already impaired. You see, so that already on its own that is very severe, right? Yeah. So it can be very severe, and also Alzheimer's is not a joke, right? It's not a joke. Yes.
Okay. Food for thought. Have you? Because we all have stories of us going to the dentist.
Yes.
Do you think we leave it to, or have you left it to a point where now you can't use your mouth?
Yeah.
And I have a story. This is my aunt. Sorry for exposing you, but she, because it was that bad and it even affected her gums. The general talk is you feel like air is coming into your mouth, so you don't want air to come in. She couldn't speak, and it affected her ears. She couldn't speak for the longest time. She couldn't eat, and she couldn't hear properly. And I was like, how does it even get there? What are some of the stories that you have when it comes to your oral health? Please share them with us on the Facebook page. We are live on Oral Health N, and also on X we are at N_health. And today we are visiting a dentist to tell us more about some of these issues. Some of the common things is flossing.
Yeah.
And there's online, I saw this when I was doing research, there was a bit of a talk around that. Some prefer not to, some do. The question is it important? Should you floss, should you not floss?
Yeah. Flossing is very important because brushing your teeth alone basically will give you up to 60% cleanness of your teeth, understand? But most of the time, there's food in between the teeth that can only be removed by floss, right? And when we talk about flossing, it's very important that the viewers know we're talking about the screen, not toothpick. Because when people use toothpick, you are using your toothpick on one area of the mouth, and normally people use one toothpick throughout the mouth. So you are spreading infection throughout your mouth. So if there was infection or a huge amount of pathogenic bacteria at one point of your mouth, now you're spreading it throughout, you see. So we are accelerating the infection.
So are you saying we must not use toothpaste?
Yes. That's what I'm saying. We are against toothpicks. Even the string floss, Yes. And I know many people are invested in those things, and we find them in most homes, but they are not good.
Wow. Speaking of food, I want to speak about then which foods, or we can even group them, but which foods are then bad for our teeth, for our oral health, and versus foods that would be then said to be good for our teeth.
Sugary foods, sticky foods, especially like your toffee, like that is very bad. Heavy alcohol consumption. We know that alcohol is toxic. It decreases your so it affects your immune system. You see, so and also unhealthy foods in general. So normally we always recommend that people stick to leafy greens, your vegetables, your fruits. Have lots of water as well, because water it prevents your mouth from dryness of the mouth. Because normally when your mouth is dry, then it allows the pathogenic bacteria in your mouth to multiply in a sense, and to thrive, and also gives rise to bad breath as well, right now. So it's always good to drink lots of water as well.
Okay, I did that for alcohol because,
Yeah.
for other reasons. We really don't think about. I mean, we just think it's our mouth, and I really don't have to take an extra, say, precaution in terms of taking care of it, like the foods that we eat, things that we consume, things that we put in our mouth, like a toothpick. And I've seen other people put other things in their mouth, but
Yeah.
we won't speak about that. Which foods? I mean, like plastic, and sticks. All those things, Doc. It's a lot of things. How can, okay, you spoke about bad breath while we were giving the lines of food, but which foods then would promote good teeth and gums? I don't want to say that we should have on a daily, but actually maybe have on a daily or every now and then you should, consume to aid the teeth and the gums.
Yeah, so normally we always advise that people, dairy products, of course. Excessive consumption of everything is bad for you, but dairy products are good because we're focusing on the calcium that we find in the milk, right?
Yeah.
Of course, like I said, your leafy greens and your vegetables, your fruits, those are rich nutrient foods, that are gonna help your general health, yes. Also your water. You see, so if you've listened well, I haven't mentioned any unnatural
supplements and other
yes.
Okay.
These are all natural sources. Yes. Your lean proteins as well. Your peanuts. Those are good foods for your body and for your teeth, for your oral health.
I want to touch a bit about bad breath. We think it's a lot to do with our teeth, but can it? Because I'm thinking we're speaking oral. Where does it come from? I don't think it's only on teeth. It could be in the gums. It could be on that. Could it be in the gums? Could it be on the tongue?
Yeah. So bad breath can come from many sources, but one of the most common sources that we find is from teeth that are decayed, right? Because when you've got a decayed tooth, basically the food is inside the hole, and it's rotting inside. That can give rise to bad breath. Your tongue, many people don't scrape their tongue, for example, when they're brushing. You see, so because when we eat our food, we use our tongue to digest the food. When we push the food against the palate, to digest it. So you find out there will be a layer of food in your tongue that over time, if it's not brushed off or scraped off, then that can give rise to bad breath. But another source, of course, is gum disease. There's people, for example, who have ulcerative gum disease, which is basically swelling, bleeding of the gums. Also, which can give off bad breath as well. Basically it's just an infection of the gum. Yes. So normally that's where we see the sources of halitosis or bad breath from. You see? Yeah.
Got you. Let's speak about teeth sensitivity. I know sometimes it has to do with temperature. If you consume too cold or too well, I'm just thinking that could be an indication, right? Not necessarily it could be the cause. You could correct my assumption. But if it's too hot, it's too cold, you can feel it in your teeth. But what causes teeth sensitivity?
All right. So I think first, I think it's important for people to know the tooth structure as a whole. So the tooth is made out of 3 layers. The outer layer, which is the strongest part of your body, is made out of the enamel, right? And then you've got your dentine, which is underneath the enamel. Then you've got your pulp tissue or your nerve tissue, right? So normally when people suffer from sensitivity, it's because the outer layer, which is the enamel, is worn out. So anything that compromises that layer is what will lead to sensitivity. It could be because of acidic drinks, because it's corrosion, like erosion of the enamel. It could be tooth decay, right? Because now the tooth structure is breaking down because of rotting, this bacteria that is eating up the enamel layer. It could be because the tooth is cracked People have a habit of opening bottles and stuff around the house with using their teeth, so that can crack their tooth, and it exposes the dentinal layer of the tooth structure, which is very sensitive to either hot or cold. You see? Yes.
Okay.
Yes.
Got you. Let's two last questions, and I'm gonna let the doctor be. But second to last, how do I know if I have gum disease? You touched on it that it could also be a contributory factor to bad breath, and sometimes we don't even know this. Especially when you use the toothpick, sometimes you can poke on the gum. But what causes gum disease?
So gum disease principally is caused by pathogenic bacteria in your mouth, right? So this bacteria, it basically eats up, the gum.
So you told about the bacteria, even the bacteria, is it in our body? Do you consume it? Where does those pathogenic bacteria come from?
So as people, we have a lot of bacteria in your mouth. They say that you've got more bacteria in your mouth than outside, right? But then now, when you are immunocompromised for, let's just say, maybe consuming a lot of alcohol for extended periods of time, or you've got a disorder or like a certain disease that you're suffering with, let's just say diabetes, or maybe the upper stages of HIV and AIDS, understand? Then your immunity drops, right? So like I said before, then that allows the pathogenic bacteria. Remember, so the bacteria, you've got good and bad bacteria in the mouth, right?
Yeah.
But now in your healthy state, there's a balance. But now the moment your immunity drops, then the pathogenic bacteria thrives, you see. So normally we see, that's where most of the gum disease comes from, right? So, but also besides the source, besides the drop in the immunity, also it can also be due to plaque buildup, because of you're not cleaning well at home, you're not brushing, you're not flossing, and you're not going to the dentist for your monthly visits. And the plaque, it attracts a lot of bacteria, because the plaque, it acts as a shelter, whereby now when you're brushing, you can't even reach that bacteria as well. You see, so buildup attracts a lot of bacteria. Yes.
Interesting. Last question: can oral health also visibly show an STI? I wanted to say which kind of STI also, but if I have a sexually transmitted infection, can it be?
Yeah,
this?
Yeah, it can.
Yay!
So for example, your STIs, like from your HPV, which is the human papillomavirus, your syphilis, even sometimes signs of the progressed stages of HIV and or HIV and AIDS. You can see the signs in the mouth. Like there will be oral manifestations. You understand? But for example, with your HPV, right, which has several types, you'll see things like your warts, which are like growths. They can be on your lips, on your cheeks inside, on your tongue, you see. So, of course, we know that you get this STD through oral sex, mostly through oral sex. Others, it can also be through skin-to-skin contact, but most of the time you get it through oral sex. And because kids nowadays, they love oral sex. Sorry. I'm sorry. But yeah, your HPV. So dentists are able to detect it during your 6 months checkups. We can know and say, okay, this is what you have, and then we treat it accordingly. Some, they will have to be excised, which means we have to cut it, take it for biopsy, whereby we can confirm, okay, this is HPV, this is this, or this is that. Sometimes blood tests are required. For example, for syphilis, they also do take blood tests, you see, just to confirm that this is it.
Listen, that's a lot.
Yeah.
But it's necessary information nonetheless. I'm I'm done. I think, if you've missed this conversation, please go through and check it out. But we've learned it's been a fascinating conversation all through. Let's continue taking care of our oral. In closing, somebody who wants to, I guess, maybe start on the, also maybe how soon should you start, on the oral journey of finding out things that are happening in your life? As soon as like 6, or when you're a baby?
No, yeah. We normally say as soon as the first tooth comes out, that's when the child should be.
If you've missed that opportunity,
which most of us have. As soon as you hear this message, I guess.
As soon as you hear the message,
start your oral health journey. As soon as you hear this message, there's no that. Yeah, as soon as you hear this message,
the sooner the better.
The sooner the better.
Most definitely. Dr. El Magadla has been such a great sport. Listen, thank you so much for joining us. Let's catch you on the next one as we look at yet another clinical topic from myself. And happy and everybody in the house. Happy streaming. Bye.